Thank you for joining us today. We have with us the Executive Director of CDPHE, Jill Ryan. We have Mike Willis, who's the State Director of Emergency Operations Center. We have Stan Hilke of Public Safety, Dr. Katie Anthis, the Commissioner of Education, Inta Morris from Education, Dean Williams at Department of Corrections, and Kim Bimsteffer at Healthcare Financing Agency. As you know, our team has been preparing for this situation for months, and we continue to know what we knew before, and we will know tomorrow that this will get worse before it gets better. 8 days ago, we announced that we were opening the Emergency Operations Center and taking the initial steps to prepare. 6 days ago, we announced our first confirmed case of novel coronavirus, or COVID-19, in Colorado. Yesterday, I announced a state of emergency in the state of Colorado that included updates on our testing capacity, emergency rules and guidance on paid sick leave for employees to be tested. That went out today, that wage order. And I reiterated instructions on how to protect yourself and what to do if you may be sick, as well as announced that residents of Colorado over 65 and up can renew their driver's licenses online. That also began this morning. From the beginning, our top priority has been protecting public health, and especially our most vulnerable, and that means older Coloradans, and it means those with underlying health conditions, particularly respiratory conditions. That also means regularly supplying the public with clear and accurate information and appropriate guidance to keep people safe. That doesn't mean that we're going to be here every day making announcements, but it does mean you will be regularly informed by our office. And in fact, several updates went out today with regard to cases and where they were. It also means that we will regularly be available to answer questions. The transparency and trust are absolutely critical, and that means in public health at the county level, the state level, your doctor, and of course with your own individual responsibility and the measures that are absolutely critical that every Coloradan take. We're going to continue to supply the public with clear, timely information to the best of our ability on a regular basis. Today we confirmed 16 additional positive cases of novel coronavirus here in Colorado. Again, you may hear them referred to as presumptive positive cases. We act on them as positive cases. That difference in terminology is because until they're confirmed by CDC, they're formally called presumptive positive cases. But when I refer to positive cases, it's generally referring to the ones that we've identified here in Colorado. We're not waiting for that CDC process. So 16 additional cases today. That essentially doubled the number of positive cases in Colorado. It brings the statewide total to 33 with one indeterminate test that we're also treating as positive. We've confined 9 cases of coronavirus in Pitkin County. So we are beginning to identify what looks like a hotspot. They are all related to a single visitor from Australia. This shows the transmission of this virus, and we've seen this in the Boston case. We've seen this in other cases where a single person can spread this virus to tens, dozens of individuals. And that's what we appear to have seen in Pitkin County. In addition to Pitkin County, we've confirmed a total of 25 cases from 9 other counties: Arapahoe, Jefferson, Larimer, Gunnison, Denver, Douglas, Eagle, El Paso, and Summit. At this point, we can confirm community spread in the high country of Colorado. And while we're still investigating and have not yet confirmed community spread in the Denver metro area, we are acting and treating it as if that is already occurring, and that is the likelihood. In order to address community spread, we are working in tight coordination with the local public health agencies. These are generally your county public health agencies: Denver Public Health, Tri-County, Arapahoe, Douglas, Adams. And we are working closely with them in the impacted areas, deploying resources to help them deal with the crisis. And that includes protective equipment, it includes state personnel, it includes other support. It's paramount to be honest about what the coming days and weeks are going to look like here in Colorado. We have information on this based on the trajectory that has occurred in other areas. We are taking the actions we need to reduce the spread, protect our most vulnerable, but even in areas that have taken similar actions, while the spread is less, we continue to see the spread of the virus. The public health experts who work for the state of Colorado are advising me that we are likely on the verge of a tipping point where we will see more community spread in the days and weeks ahead. Just today, a doubling in confirmed cases. Again, some of that is due to our increased testing. Part of what we saw in Washington is it spread in a stealth way before the cases were confirmed. That has likely occurred here to some extent, a lesser extent than Washington, because we're ahead of where they were on testing, but we are aggressively pushing the testing. We'll have a lot more information about the degree of the community spread when we find out the results shortly from the testing that we did today at Lowry of about 160 people. We know that, by the way, what we saw today was evidence of community spread. It appears the virus will be disproportionately hitting our resort and mountain communities first. And that doesn't mean it will hit our resort and mountain communities exclusively, but it means it will hit those communities first based on the numbers we're seeing. And of course, we're concerned with people traveling back and forth between population centers and those communities. We know that in particular, these community healthcare systems in our mountain and resort communities have limited surge capacity. They are also generally at higher altitudes. So I am advising our resort communities that provide guidance that travelers over 60 or with chronic health issues should avoid unnecessary travel to the high country areas with the outbreaks, in particular because of the lack of healthcare capacity for hospitalization and ventilation in these areas, as well as the identified hotspots of community spread. We will continue to assess this on a daily, if not hourly, basis with regard to each of the communities affected. Now, as I said yesterday and will often repeat, it's very important to put this information in context. Fully 80% of those who contract coronavirus, COVID-19, will have mild symptoms, will not require hospitalization or medical treatment, can use over-the-counter drugs for symptoms as necessary, and will fully recuperate. My administration is focused on protecting the most vulnerable populations and the broader public. We are recommending that our vulnerable populations, the elderly, those with underlying health issues, reconsider attending large-scale community gatherings to better protect themselves, as well as the public health. I've asked our CDPHE Executive Director to engage in emergency rulemaking to limit visitation to senior facilities, conduct screening of visitors and staff, and take additional necessary steps to protect those in our care. That will be forthcoming in the next day. We also instructed CDHS, the Department of Human Services, to enact policies for the facilities that they directly manage, that our state directly manages, for seniors and for vulnerable populations, including veteran centers, regional centers, and the Colorado State Mental Hospital. We need to do everything that we can to protect those who are most at risk during this period. We're also issuing guidance to protect staff as well as those in custody at our 24/7 facilities, including our correctional facilities across our state. We're also taking steps to ensure that all state workers have paid sick leave to make sure that they don't come to work sick or expose others. We are asking partners in the private sector to do the same, and through the emergency order, we are ensuring that that occurs for those in occupations that can be particular vectors for contagion: food services, hospitality, home care workers. That was the order that went out today that we talked about yesterday. My administration is also issuing guidance to all K-12 schools and districts in the state, recommending that if they have a student or faculty member who tests positive, that they close for 72 hours, allowing them to disinfect the school, and for the epidemiologist to conduct an investigation and recommend the next step for those schools. We'll make that school guidance available to the public. That includes, in the incidence of multiple cases, closure for 14 days for those schools. And if there are several schools in a district that are affected, then it will be recommended closure for the school district for a period of 14 days. I can't stress enough the importance of the fact that the government alone, our public health system alone, cannot stop or even significantly slow the spread of the virus. What is required is individual responsibility and action. That means that every Coloradan needs to take personal responsibility to practice best hygiene practices and social distancing, including isolating themselves if you are sick with flu-like symptoms. That also means that Coloradans should wash their hands with soap regularly. I washed my hands about 11 times today with soap. It means no handshaking. I have begun practicing that as well, doing the elbow bump. And again, that is going to be a very important vector of transmission in the areas we've seen. Avoiding handshaking is critical. Increasing distance between people. This has been estimated by the scientists and health community of having about a 6 to 8 foot spread. These are the heavy waterborne molecules from your nose or from your mouth. You are significantly safer at a distance of 6 to 8 feet from somebody who's infected with coronavirus. And of course, stay home if you're sick, and keep your kids home if they're sick. I applaud CU Boulder, Metro State, and Colorado College for taking the steps to minimize community spread, moving to online classes, and extending spring break. These are common sense measures that will help Colorado slow the spread in areas that could become potential hot sites because of close living conditions and people who eat and dine together. I also wanted to give you an update on our current testing capacity and regime. To date, we've completed test results for about 300 Coloradans in the state lab. This morning, we opened up our drive-through testing facility at CDPHE in Lowry. I want to thank our CDPHE staff for getting that unit up so fast. This is a best practice that we have seen work in other nations. As far as I know, I think it's the first or one of the first in our country, and I hope that other states promptly follow our lead. We will be looking at additional testing sites across the state as soon as we can. The facility was open from 10 a.m. to 2 p.m. today, and over 160 people were swabbed, thanks to the hard work of our medical professionals. This will give us very important data about the overall dispersal of the virus in the Denver metropolitan region. Why? Because, again, with 33 positives out of 300, those 300 were heavily prioritized for testing, meaning they were found to be very likely to have it. They traveled, or they were exposed to somebody who traveled, or they had a family member who had it. Even so, you're talking only of about roughly 10%, 11% that tested positive. This 160, many of them are one level down, meaning these numbers, if they are close to 10%, that would mean the virus is more prevalent in our area than previously expected. If these numbers are closer to 3 or 4%, it would be more in line with what we think. If they're lower, we might have a little bit more time to act. So it's very important to learn about the dispersal from these results. We will not get all of those within 24 hours, again, because our state testing lab facility is handling as many as they can, but we have sent some of those out to our private laboratory partners, which could take 3 or 4 days. That facility will be open again tomorrow, of course, and we're looking forward to getting a drive-up testing center operational in the high country in the mountains as soon as we can. These are also important because we want to make sure that people who might be at risk or think they have coronavirus are not going through the entrances of hospitals and potentially risking other patients and staff. There are other hospitals and practitioners that are engaged in testing. Many of them have established site-based or area-based protocols to do that in a safe way. As I said yesterday, we have hundreds of tests that remain available. We're expecting an additional 1,500 test kits from the CDC. I also talked to the heads of UC Health and Children's today about expanding testing and being able to process those tests in-house. That would give us the advantage of quicker results. Right now, again, once we maximize our state capacity each day, they go to LabCorp or Quest. That's a 3 or 4 day turnaround. Once we have that capacity at the state level, which we hope occurs in a week or two, then many of those will also be processed within 24 hours, and that can be scaled more rapidly. And a proper containment effort will require thousands or tens of thousands of tests administered each day. And we need that as soon as we can. In the meantime, those who are experiencing flu-like symptoms should isolate themselves and not spread the flu or coronavirus, even though in most cases, if you have flu-like symptoms, to be clear, you are experiencing the flu or a seasonal cold. That is more common. And again, but whether you have that or whether it does turn out to be coronavirus, please isolate yourself immediately. Treat it more seriously than we would during a normal flu season or cold season because of the risk that what you have might in fact be coronavirus as we scale the testing. That is incredibly important, and as your test is pending, that's incredibly important. I want to also point out that the testing facility at Lowry, while we've expanded our testing criteria, you do need, in effect, a doctor's note, a doctor's order to have that test. You can get that electronically or physically. I'm really calling on the federal government and our private sector partners to do everything we can to exponentially scale testing as immediately as we can to help us limit the spread effectively. Now, I know the last few days have been difficult for our team, for our state, for many concerned viewers at home who flip from station to station or website to website and are feeling a lot of anxiety now. First, of course, there are more difficult days ahead. And I know that many Coloradans are upset, frustrated, and in fact scared. Some are disappointed that your conference or your graduations or your gatherings are canceled or might be canceled. Your travel plans might have to be postponed or interrupted or canceled. And those are normal feelings. We all understand that and we all share that. But we need you to be part of working with us to do everything we can at the state level to respond to this virus and to reduce the trajectory of its spread. Now, as I said yesterday, there's only so much that any government can do. The most important person who can help stop the spread of the virus is you. We all have a role to play. Everyone's essential. This is really a test of our Colorado character, a test of our ability to put the interests of our state, the interests of our community up front. Now, I know that we can meet this challenge, but I know that we need to look out for one another, and that means staying home from work or school if you're sick. It means getting yourself or your children tested for coronavirus if you're experiencing symptoms. It means employers providing paid sick leave. It means that young, healthy people should take the proper precautions so that they don't infect, perhaps fatally infect, vulnerable populations. And that means following isolation and quarantine instructions if you're sick or have been exposed. And I know that can be hard. I talked to the very first case identified in Colorado, a traveler from California who was visiting Summit County who's still in isolation. And I told him, I know it's hard. Let us know if you need books. Let's make sure you have cable. You need to stay there for 14 days. And that goes for anybody who tests positive or who has pending testing results, pending those results. For parents, it means taking responsibility for their children to follow proper prevention protocols. It means following the proper guidance, even if it's personally inconvenient. You know, and that means something like washing hands in Colorado. We have dry weather. People's hands get chapped. I've experienced chapped hands. That's a minor price to pay for washing your hands regularly with soap throughout the day. You can use lotion afterwards, but wash your hands with soap. It's incredibly important. This pandemic, and it has been declared a pandemic by the World Health Organization, is not about politics. It's about people's health. The only way we're going to contain the virus and prevent widespread damage to our way of life and long-term damage to our economy is if we do right by our fellow Coloradans. Now, we've been here before as a state and we've prevailed. From natural disasters like wildfires or the floods of 2013, to mass shootings, to threats of terrorism, and even past pandemics a century ago. I'm asking our fellow Coloradans to rise to this challenge once again, to show our character, to do our part to fulfill our individual responsibility, to protect our health, the health of your vulnerable loved ones, and the public health. We are truly all in this together, and we look forward to doing everything we can from the public side, including transparency and acting as quickly as we can with the information we have to further the public health. With that, I'll take questions.
Governor, you've said that we are on the tipping point for community spread and community transmission. Other states like California and parts of Washington have put a limit on public gatherings. There's an Avalanche game tonight. Have you considered putting a limit on public gatherings and the number of people that can be in a space at one time?
In the next 2 days, I'll be having conversations with the faith community as well as with those who operate venues in Colorado. I want to be clear with regard to the current guidance. The current guidance is if you are over 60 or you are vulnerable, we advise not to attend large congregations of people. Again, this changes by the moment, this changes by the hour based on information and based on science. What I will be presenting to both the faith community as well as the venue community, and I shared privately with some in the faith community and some in the sports community today, is that we want them to establish protocols where they can have safe spacing at events, meaning is there a way where they can have people attend, and that group would have a 6 to 8 foot, it would have 6 to 8 feet before there was a second group. So I know our sports owners and many others will be looking into whether they want to operate at a diminished capacity, what that capacity would look like, what that process would look like. Again, if there is an immediate threat to the public health, we won't hesitate to take those same actions that other jurisdictions have with regard to closing down public events. But we also want to make sure that there are other alternatives that can be considered. With regard to the faith community, we're encouraging all of our faith leaders to encourage elderly parishioners and those who are facing chronic ailments to consider not attending physically Mass. We have seen faith-based presence as a vector in at least a couple instances in this country as well as in other countries. We are also encouraging, of course, our faith leaders to use their soapbox to talk about the same personal responsibility issues that I raised here today in terms of remaining home if you're sick, washing your hands, as well as taking care of members of those faith communities that might be under quarantine or isolation. I mean, can members of that faith community deliver groceries to their doorstep and other ways that we can make life more tolerable during those periods of isolation and quarantine? Are you talking about colleges or high schools, or what are you talking about? So again, the protocol for the K-12 schools will be when the first case is diagnosed, there should be a 72-hour closure, a cleaning of the school. When there are multiple cases, we are looking at 14-day closures. And when there is a hot spot identified in a community or multiple schools in a district, we're looking at district closures for 14 days. That could overlap with the spring break, meaning if there was a case, multiple cases before spring break and a 7-day or 9-day break, 2 weekends, that would only mean an additional 5 days. It just depends on the school schedule.
But are you worried that after spring break that somebody could bring something back?
Again, we're going to re-examine all these protocols, update them on a regular basis. These are the protocols for now that we have.
Governor, what's the state of our supplies of emergency supplies for frontline workers?
We have tapped our state reserve for N95 masks at a request from, was it Eagle or Pitkin? Eagle County. When that is exhausted, it is not exhausted. I talked to our congressional delegation today about a request to tap into the National Reserve. But for where we are now, we have those sufficient supplies. What's that? Let me also publicly thank our partners at UC Health and Centura for helping our state with the swabs that are necessary for diagnosis at the state treatment site. We appreciate deeply their cooperation in helping with some of those simple forms of lab equipment like swabs that are needed for us to successfully do these tests.
Governor, what should the state legislature do, because they're debating whether or not they should shut down? And if they shouldn't shut down, so should they limit access to the Capitol to school groups to rally?
That's entirely up to the legislature. Again, for any public gathering, we are encouraging those that are at most risk, are elderly, those who have a chronic illness or a respiratory condition, to avoid large gatherings. Watch for that guidance to potentially change in the future, but that's what the current guidance is.
Governor, how hard has it hit the economy so far, and how hard do you expect it to hit Colorado's economy?
Well, this is hitting the global economy, of course. Colorado is no exception. By taking the strong actions that we are taking as quickly as we can, the sick leave, the driver's licenses, the nursing home order, the K-12, the college, and of course more to come, we hope that we can have a less impact long-term on the Colorado economy. But this is getting worse before it gets better. That's not a statement about Colorado. It's not a statement about America. It's a statement about the entire world.
What about tourism though, especially in the high country you're talking about, that's hard hit?
Yeah, two industries that are going to be harder hit, of course, will be tourism, and then of course with the pricing on oil and gas, the energy industry, partially coronavirus, partially OPEC pricing wars at the same time.
Governor, are you going to be able to offer, are you looking at offering any help to businesses to get paid leave to employees?
So that's being discussed at a national level in Washington. The first package that was passed, over $8 billion. In fact, I think the $9 million piece will come to Colorado soon that will help support some of this important work we're doing. The $8 billion piece was around public health. Congress is considering, and I discussed with our congressional delegation today, a second piece that might include public health as well as some economic stabilization factors. Both of those are incredibly important, and I encouraged our congressional delegation to particularly focus on some of the most impacted industries like tourism.
Governor, we've got a lot of calls in the tornado about a volleyball tournament that happened last weekend and it's happening this weekend. We're concerned because people are flying around the country, and we talked to the organizer and they said they're not going to cancel it unless they get state or city interventions. I know you already touched on wanting these organizations to do right and make sure they're taking precautions, but at what point do you guys feel like you need to step in to protect people with Colorado?
So again, the current guidance is that people who are over 60, our most vulnerable population, should avoid public gatherings. We want every Coloradan to take precautions in any group of people, whether that group of people is 20 people or 100 people. And of course, again, we would not hesitate to take stronger action around public gatherings should the situation arise where, for instance, the Denver metropolitan area is a hot spot. We are looking at those additional measures. Again, the likely first areas where this spread has occurred are those several communities in the high country that have more cases than Denver and less population. So you're likely to see actions in those areas before you see them in the Denver metropolitan area. Sorry. Have we gotten one? Is there one? How many confirmed?
I think
One or two? It's not too relevant to us because we have to move faster than that. So I mean, it's nice to dot your I's and cross your T's, but we don't have that luxury. It doesn't change our behavior one iota. We're moving forward. There's 33 cases. There's a lot more that we know are undiagnosed. We expect to have more data on that in the coming days. We hope that CDC acts quickly, but frankly, if they could do one thing for us, it would be to send us more testing kits more quickly. That would come ahead of confirming our cases.
Last one, what could Colorado do with the $9 million federal emergency funds?
Yeah. Can somebody address the specific use of that? Eric? Yeah.
There's a number of different ways that we can use federal funds. One of the things that it helps us with is procuring additional staff and manning the operation centers that are required to manage this incident across the state. It can also be used to purchase the additional supplies that the governor mentioned and to pay for future supplies. We anticipate that this is not a short-term problem, and so there will be costs over time. And so those are the two principal ways that can be used. As you can imagine, there are still a number of unknowns as this develops, and so those kind of funds helps us cope with unknown and ambiguous situations like this.
Your name, please?
I'm Mike Willis. I'm the Director of the Office of Emergency Management.
What's it going to take for all this to end? How long do you think it's going to go on for?
So the simple answer is we don't know. Again, with a high degree of confidence, I can say this will get worse before it gets better in Colorado, in the United States, across the world. We have seen this play out in areas like Korea and China, where they have, through strong measures, at least reduced the spread and altered the trajectory over time. But again, until there is a vaccine, until there is a cure, some incidence of coronavirus is here to stay. So, and I'm not the one to talk about the timeline for a cure or a vaccine. I know that among the many global teams doing that work, there's one at CSU that is engaged with that work. There's in Europe, in Israel, in China. We hope that that comes sooner rather than later, but we need to do what we can with what we have.
Are there red lines that you need to cross, so to speak, in order to reach that next level
Yeah.
of things that you are going to do?
So again, we're using the best science and data we have based on outbreaks that have occurred, the steps that have been taken successfully to limit them. That's why we have the school guidance today, again, with a single case, 72-hour closure, cleaning. With multiple cases, we have a longer-term closure. If there's a hotspot in an entire school district, that school district will be closed for 14 days. We are applying that across a variety of areas as we balance the desire of Coloradans to live fulfilling lives, the desire of Coloradans to support themselves, and for businesses to be able to succeed with the need to prevent even greater damage to our economy, the quality of our lives, and in some cases, particularly the most vulnerable, the sacrifice of their lives themselves. We are doing everything we can to protect our most vulnerable and protect the public health. With these additional steps today, just to be clear, what we're announcing today, the labor rule went out this morning that we talked about for sick leave. The driver's licenses are live. The three new things that we're announcing today are that we will have rules again tomorrow on nursing homes and senior care facilities, limiting visitation, testing for staff and for visitors, the K-12 guidance, and then the higher ed guidance as well. Now, again, many of the institutions have gotten ahead of that. We applaud them. That's fine. That's terrific. I applaud their work. We will also have that baseline higher ed guidance because there are some less well-known private colleges and universities across the state that will also fall under that, as well as our large publics. We will, again, update the press regularly. We're balancing that with our need to engage in the emergency management, which will also be intense in the days and weeks ahead. And we ask for your help through your news outlets, through TV, through print. Many of you have done, and I encourage you to continue to push the personal responsibility practices around hygiene, around staying home when sick, around the symptoms. Many of you have done excellent information graphics. Please continue that work. We need to make sure that all of that best, most accurate, most up-to-date information winds up in the hands of your viewers. Together, we will get through this together. It's a test of our Colorado character. Things will get worse before they get better. But there will be a light at the end of the tunnel. Thank you.